And there's a fertilization of that egg as it's moving through the oviduct. In order for the pregnancy to continue successfully, you want that now fertilized egg, which would almost always get fertilized somewhere in the fallopian tube or the oviduct, to make its way all the way down into the uterus and implant in the wall of the uterus.
Right.
An ectopic pregnancy is when that fertilized egg implants somewhere else other than the wall of the uterus, most often in the fallopian tube. It never gets down there. It could, however, go back out the end of the fimbriae, land on the ovary, on the outside of the fallopian tube, somewhere in the abdominal cavity. It could land somewhere in the uterus that's not adequate, like down close to the cervix. But especially any of those situations, what it's going to do is the growing embryo secretes hormones that stimulate the development of the blood vessels that are supposed to provide nutrients to the placenta as the fetus grows. The uterus is meant to do that. Those other organs are not. And if those blood vessels start to develop, they're at risk to burst and hemorrhage, and then you've got internal bleeding. And so as soon as a woman comes back with a positive pregnancy test, the first thing that would be done, what you wanted to have done, is an ultrasound to see where the embryo has implanted, to be sure that it's in that part of the uterus that can support the growing fetus. And if not, it's a pregnancy that pretty much has to be ended because the mother's life is at risk. Okay? On to boys.